Welcome to the fourth and final presentation in the series of the INACSL Standards of Best Practice. This presentation will focus on the standards for participant evaluation, professional integrity, and simulation enhanced interprofessional education, Sim-IPE. The first three presentations have been recorded and can be available for future viewing. As a review, in our first presentation, we discussed the history of the INACSL Standards of Best Practice. Those first standards were published in 2011 and have been reviewed, revised, and updated, with the most recent changes occurring in 2021. The new 2021 standards can be found on INACSL's website, inacsl.org. The standards we covered in previous presentations include simulation design, outcomes and objectives, facilitation, pre-briefing, and debriefing. INACSL also supports the use of the Healthcare Simulation Dictionary produced by the Society of Simulation in Healthcare. The dictionary is located on SSH's website, ssih.org. The most current version of the dictionary is the second edition, 2.1. This edition has expanded on the original 127 content terms with an addition of common abbreviations and 40 new terms. The objectives for today's presentation are as follows. At the conclusion of this educational program, learners will be able to identify methods of participant evaluation, recognize attributes of professional integrity, and understand strategies for simulation enhanced interprofessional education, Sim-IPE.
The first standard of best practice we will explore is participant evaluation. All simulation-based experiences require participant evaluation. The specific value of simulation allows the facilitator to assess the student's status, progress, and determine the learner's needs. Simulation-based experiences require participant evaluation to differentiate them as a learning experience. Imagine if you are just in a simulation and there's no defined objective or outcome that could be quantified as play. But when we have a focused intent directing us to master skills, evaluation is absolutely necessary for the learner and the evaluator. Authentic evaluation of the participants using simulation-based experiences includes determining the intent of the simulation-based experience, the design, the timing of the evaluation, the use of a valid and reliable assessment tool, evaluator training, and interpretation of the results. The criteria necessary to meet the standard of participant evaluation include the following. First and foremost, it's necessary to determine the method of participant evaluation prior to the simulation-based experience. Is this a formative evaluation, a summative evaluation, or a high-stakes evaluation? Formative evaluation of the participant fosters personal and professional development to assist the participant in progression toward achieving objectives or outcomes. Summative evaluation focuses on the measurement of outcomes or achievement of the objectives at a discrete moment in time. High-stakes evaluation refers to an assessment that has major implications or consequences based on the result or the outcome, such as the NCLEX. Potential consequences of not following this standard may lead to inaccurate assessment, poor participant experiences, poor learning outcomes, failure to progress, inappropriate selection of tools, or assessment bias.
Professional integrity refers to the ethical behaviors and conduct that are expected of all involved throughout the simulation-based experience. Professional integrity encompasses personal attributes such as confidentiality, compassion, honesty, commitment, collaboration, mutual respect, and engagement in the learning process. Acting with professional integrity extends to everyone involved in the simulation experience, including our participants, facilitators, debriefers, faculty, and observers. Everyone should be aware of his or her own personal and professional behavior and how it affects others. One attribute of professional integrity that is in the forefront of pre-briefing and throughout the simulation experience is confidentiality. The level or degree of confidentiality is dependent on the policy established by the institution. At LSU Health New Orleans School of Nursing, we hold confidentiality in the highest regard because it has a direct correlation to creating a safe learning environment and protecting psychological safety. Not following the standards for professional integrity and maintaining confidentiality can lead to unanticipated behaviors and/or interference with simulation-based outcomes. Participants may have an inability to be fully immersed in the simulated-based experience, altering or biasing an individual's performance. It can affect one's confidence, self-esteem, create a sense of distrust, loss of a safe learning environment, and alteration of the group dynamics. Some additional attributes and criteria for maintaining professional integrity includes being organized and prepared for the simulation experience, creating an environment based on trust, safety, and mutual respect through collaboration. Other guiding principles of professional integrity are to maintain current and up-to-date knowledge related to the standards and best practices in simulation education. Success in maintaining a safe learning environment requires clear communication, active learning, reflection, deliberate practice with honest feedback in a respectful and effective manner.
We're now going to talk about the standard, the INACSL Standards of Best Practice, Simulation Enhanced Interprofessional Education, or Sim-IPE, as it's more known as. So Sim-IPE enables participants from different professions, and it's 2 or more, to engage in a simulation-based experience to achieve shared or linked objectives and outcomes. Our Sim-IPE criteria are to conduct Sim-IPE based on a theoretical or a conceptual framework, utilize best practices in the design and development of Sim-IPE, recognize and address potential barriers to Sim-IPE, and to devise an appropriate evaluation plan for Sim-IPE. So just with all the other standards of best practices we discussed, these should seem all familiar. So with our interprofessional education, we also want to think about our theoretical or conceptual frameworks. So you might want to think about the NLN Jeffries simulation framework, Kolb's experiential learning, adult learning theory, whatever you're comfortable with. Always think about the design and development of Sim-IPE just as we do our regular simulation. Recognize and address potential barriers to Sim-IPE. Now, these barriers can be different because we have 2 or more professions coming together. So you want to think about resources. What do we need more resources? Are there more learners involved? Financial support. Is this space big enough? Do we have enough equipment? Time. Trying to schedule different learners from different professions at the same time can be challenging, but it can be done. And faculty, of course, are faculty available. Other barriers can be faculty development. Faculty from different professions may be coming with very different backgrounds in simulation, or they may have the same background. So you just want to assess that and see where everyone is. Faculty development may be needed for faculty coming from intraprofessional backgrounds, especially when it comes to debriefing. And then think about sustainability. You know, once you create, a really good Sim-IPE, think about doing it again and again so that it's part of the curriculum if it can be. And that way you've got that meaningful learning experience for all the healthcare professions or whomever is involved in that interprofessional simulation. So another way to guide Sim-IPE is with the IPEC Competencies. So the Interprofessional Education Collaborative, or IPEC, developed competencies for interprofessional learning originally in 2011, and they were revised again in 2016. And you can find these here on the website provided. Also, another thing with Sim-IPE is Sim-IPE, when it comes to evaluation, you also want to look at what you usually do with your simulation outcomes. Are you meeting your objectives that you've set? But these are going to be interprofessional objectives now. So with Sim-IPE, though, you're also going to see, or you should see and consider, setting some team-based objectives. So teamwork, because teamwork is really a good focus and is a focus of interprofessional education. You'll hear the 4 C's of team science, and so those you will see in the IPEC Collaborative, and you can look those up. And so measuring those as an outcome is really important with your Sim-IPE along with your traditional learning objectives. So always be sure that you have an evaluation plan for your Sim-IPE. So just to recap, Sim-IPE is when 2 or more professions come together to learn from, with, and about each other with set objectives and to meet some standardized or some set learning outcomes. The simulation can be low, moderate, or high fidelity. And just with our other standards of best practice, you want your simulations developed in the same manners. Your objectives developed based on established content or theory, utilizing those best practices of design and development. Think about potential barriers. With Sim-IPE, a potential barrier is usually time and scheduling, the health professions or the learners and the faculty to come together, and always think of an evaluation plan and especially consider evaluating teamwork in one way or another.
This concludes the series for INACSL Standards of Best Practice for Simulation. For further information, you can reach out to the NSTC at nstc@lsuhsc.edu.